Good afternoon, everyone, and thanks for tuning in. My name is Callie Berkson, and I'm part of the communications team here at the City of Grand Junction. As we continue to navigate these unprecedented waters, we want to reassure you that we are trying our best to bring in our community partners and work with them closely to provide you answers to your questions. We know that there are still a lot of unknowns, and we are doing what we can to make sure that you have the resources available to you during this time. If you're tuning in on Facebook, again, we won't be answering questions live, but we encourage you to leave them in the comments below along with any suggestions that you have, and we will answer them individually and as best as we can. For the media, there will be breakout sessions after this briefing. Today, I'm joined by City Manager Greg Katyn and Mayor Rick Taggart, along with our partners from local hospitals and Mesa County Public Health. At this time, I'm going to pass things over to City Manager Greg Katyn to get our briefing started.
Thank you, Callie. We have a special guest today, just to my left, Chelsea Kobolars, and that agency, which is Center for Independence, will now be joining us every day moving forward, and so we can't thank you enough for being a part of our team to deliver some sign language interpreting to members of our community. So thank you. That's a wonderful addition to this. Again, I'm Greg Katyn, the City Manager for Grand Junction. Thank you again for joining us. We've got excellent lineup today with our healthcare providers. We had them on last week, and they've graciously come back again with us today. But to start us off from a City of Grand Junction perspective, Mayor Rick Taggart.
Thanks, Greg. I just want to talk about a city council meeting that some folks may know about, some may not. It starts tonight at 6 p.m. We are discouraging citizens coming to city council as a part of the stay-at-home order, but you are more than welcome to call in to this number, 244-1408, and leave a message that we can listen to that message this evening, or to go on our website to the COVID-19 and drop us an email that we consider for this evening as well. The most critical item on our agenda tonight is about our economic stimulus package. We are going to be talking about both the $2.2 million that we would like council to approve for jobs, as well as an additional $500,000 to help our nonprofits in the community, particularly nonprofits that are very focused on food and delivery of food to individuals that have found themselves in an economic crisis, and or help on shelter. And that help on shelter could also include things like if a nonprofit can help from a rent standpoint over these next couple of months, that would also fit under shelter. So it is a discussion tonight. We hope that it will go through and be approved, and we hope you'll tune in on, I believe it's on station 191. So thank you very much.
Thank you, Mr. Mayor. And as always, we have our partners at Mesa County Public Health and Dr. Jeff Cook.
Good afternoon. Thanks, Greg. So the update on status for COVID-19 is 16 positive cases, 279 negative, and 35 pending samples right now. So we have 2 unknown spread. Yesterday we had 3. Under further investigation, one of those was cleared. So we found a source of that one. And I just want you to know how important it is, because if we know the source, it's very easy to contain. We call that person, we get their contacts, and it's a small outbreak and very easy to contain. I think we're doing a great job of keeping our numbers down as far as the unknown spread goes, and so cross your fingers. Let's hope it stays that way. Earlier today, I'm going to pick this sign up. Is this in your frame? Up a little? Okay. Earlier today, we did a Facebook Live press conference with our partners at the Mesa County Sheriff's Office, Colorado National Monument, the BLM, and Colorado Parks and Wildlife. So starting this week, these signs will begin to appear at parking lots and trailheads on our public lands. And they're meant to remind everyone to first keep a safe distance of at least 6 feet. That's about the length of a mountain bike or a small car. Second, to pay attention, extra attention in parking lots and bathrooms. There's an increased risk there. Extra cleaning is underway in these facilities, but that cleaning is only as good as the last person who used a facility. Carry with you products needed to sanitize yourself and to disinfect high-touch surfaces. These are surfaces such as your fly rod, handlebars on your mountain bike, oars or paddles, or door handles on your vehicle. Number 3, simply please pick up your trash, please. Number 4, stay at home if you're feeling sick. And if you're feeling fine, always self-monitor. COVID-19 takes anywhere from 4 days to 2 weeks to begin to show symptoms. So even if you don't have symptoms today, you could be spreading the virus. You can check this press conference out at our Facebook page, and as always, follow us at health.mesacounty.us. Thanks.
Thank you, Jeff. And as I referenced when we started off today's program, we're fortunate to be joined by the presidents and CEOs of our local hospitals. So to start us off is St. Mary's Hospital and Brian Johnson.
Hello, and thank you for inviting me again today. It's a pleasure to be here. Before I start into my comments and updates from the hospital standpoint, I want to say thank you to 2 groups specifically. First off, to all the community leaders, governmental leaders, and private organization leaders here in Mesa County and across the Western Slope. The amount of collaboration and coordination that's been going on around the COVID-19 crisis that we're seeing today has, in my mind, been unprecedented and I think in many ways inspiring for me personally. Second off, I'd like to say thank you to all the community members. The amount of outpouring of support as we've called for help, particularly around personal protective equipment, specifically masks and other items necessary to take care of these patients in the area, as you've heard the shortages across the country. The outpouring of support from our community has been just overwhelming, and we're so grateful for that. There are many great people here in the Grand Valley and on the Western Slope, and the amount of help and support to me has been personally very humbling. So thank you. You've heard both nationally and locally from a state standpoint a lot of talk about surge planning. That has been going on here in Mesa County also at St. Mary's Hospital and across the Western Slope generally. We at St. Mary's Hospital, we meet twice daily with all of our leadership teams to make sure that we are prepared for the upcoming surge of patients coming in due to the COVID-19 pandemic. I am, along with all of the hospital leaders, meeting with the governor's office weekly, and then we are touching base on a daily basis between all hospitals on the Western Slope in Mesa County to coordinate our activities both from equipment and staffing standpoint to make sure that we know what's available and what patients are where so we can use our resources effectively. At St. Mary's Hospital, we've been doing a lot of surge planning for our facility specifically, and with our current bed capacity, we have the ability to increase our ICU capacity by nearly 300% over our normal utilization. Now, this is being done with all safety in mind. You've heard a lot about what we call negative pressure rooms, which are the rooms that are the gold standard for placing these patients in to care for, so that we can have a safe environment, or at least as safe as possible environment for our staff and physicians as they care for these patients. That increase of 300% for our RCU capability includes housing those rooms in negative pressure rooms so we can be mindful of the safety of our staff and physicians that are caring for them. Our teams at the hospital have just demonstrated incredible innovation as we've been moving forward and doing our surge planning. For example, our facilities team at St. Mary's Hospital has found a way to actually double the existing capacity of our current ventilator supply at the hospital. That's demonstrated, and they can do that safely. I think that's an amazing and inspiring story as you talk about the innovation and creativity of individuals that have technical expertise. And we're grateful for them for all their dedication and hard work. At St. Mary's Hospital, we do have enough or adequate PPE to take care of our existing patient load. That is due to several things. One, due to our system's capability and purchasing power as an organization and a system across SCL Health. And secondly, due to what I mentioned before, significant community support. We are receiving and coordinating with the community in general to receive roughly 5,000 masks per week from community organizations that are sewing those together in coordination with us so we can have re-sterilizable masks in the community. And what a great asset that has been, and again, humbling for us to receive that type of support from the community. Now, we will see that change as the number of COVID-19 patients come into the hospital, and we do receive those patients from Mesa County and outside Mesa County. The burn rate, or the amount of PPE or personal protective equipment or PPE that we use in the hospital, will increase almost exponentially. So we will rely continually on community support to continue those efforts in the area to make sure we have enough to care for those patients in a safe environment, or as safe as possible for our staff and physicians. There are a lot of conservation strategies in place to make sure that we have adequate PPE, making sure we have the right types of equipment for our staff in the right areas. We are also working through and have developed and are continuing to refine processes for re-sterilization of this equipment, because as you've heard nationally and across the entire globe, there is a general shortage of personal protective equipment as we work through this. There's a lot of great work going on, and I'm grateful to be part of it and grateful for all the partners in Mesa County and across the Western Slope. And thank you.
Thank you, Brian. Now we have, with Community Hospital, Chris Thomas.
Thanks, Greg. Chris Thomas, Community Hospital. Good afternoon, everyone. So to follow up on Brian and continue the discussion about where we are as hospitals and our preparedness, at Community Hospital, one of the things, and I think that Corey Klein will also kind of address this. Remember, our clinics are open, everyone. We have telemedicine now available in our clinics. We're seeing patients. Please call, but we want you to continue to be seen if you need it. Don't put off necessary health care if you're going to need services. Our clinics, specialty clinics, Grand Valley Oncology, continue to see patients as well as all the other clinics in our community. So please call first, but don't put off necessary health care. We're doing everything possible to keep you safe when you come to our facilities, so we'll be there for you if you need us. As far as Community Hospital is concerned, I think we're doing extremely well planning and trying to be prepared for what might come down the line. We're working closely with our partners, the Mesa County Health Department, the other hospitals, clinics. I need to give a shout out today to our materials management team. Mike Dash and all of his staff are doing a great job making sure that we're getting supplies in. We're going to our normal vendors. We're looking for other vendors to provide supplies. And so we're doing very well right now. Additionally, one of the things we're trying to do in hospitals is make sure that our employees are still employed and engaged. So if we do need them for surge, they're here available. So we're kind of cross-training. We're sending nurses to material management. We're sending PT. We actually have therapists that are working in our food service department. So we're trying to keep our staff ready so that they're here and available for you if you need us. As Brian talked about, donations continue to roll in. It's been great. Just yesterday, our school district came up with 51,000 gloves that they will be providing to the healthcare community. They are going to send those through Andy Martzoff in the Mesa County area. So I would recommend, we're available to take donations as the other hospitals, but if we can coordinate through Andy Martzoff and his team, that way Andy can make sure supplies get to the right place at the right time as we go forward. So he and his team are doing a nice job, and so we're going to continue to coordinate with Andy for supplies. One of the things right now that they're telling me is we're doing pretty well on personal protection equipment, but soap and sanitizers. So if you have the ability to help us with soap and sanitizers, that would be great right now as we go forward. As far as personal protection equipment at Community Hospital, we're doing what we can to protect our employees. So right now, and this is based on if we stopped receiving supplies today, we feel at Community Hospital, if we had 12 vent patients and we had our normal kind of hospital activity going on, that we would have enough supplies for 30 days at a normal burn rate as Brian described. Now that's if we stop purchasing. Now we're continuing to purchase, so we're not worried about a 30-day end date. But on the flip side, that's at 12 patients that are being ventilated. If that number jumps to 24, then things change quickly. So we need to continue to stay out in front of this. But we currently have about 1,200 N95 masks. We still have 3,500 N95 masks from the Ebola crisis a few years back. So hopefully in a few years we'll be able to say we have a ton of N95 masks left from this crisis also. But we are working with everybody to make sure those supplies get where they need to go. And then one of the advantages of having a new facility at Community Hospital, we have the ability, the facility was designed so we can have 50 ventilators in our facility. Obviously, we don't have 50. Right now, we have 30. The ability for 30 patients at Community Hospital. I think we're getting close to 100 in the community. So we're getting there and we're preparing to move forward. The other thing we're working on, we've had a great outpour from our other medical providers. So we are getting our internal medicine doctors, our family practice doctors are coming in, getting training on ventilators. So if we do have a surge, they'll be available to assist with patient need. To a person, they have stepped up and said, let us know where you need us and when you need us, and they'll be there. So things are going well on that front. We have 2 new babies that joined us yesterday, so the rest of the world is still moving forward. And I am cautiously optimistic that we're in good shape. We'll keep planning. I guess the fear is what we don't know, but we're trying to do our best to get out in front of this. So thank you from Community Hospital.
Thank you, Chris. And to round us out with our last speaker today with Family Health West, Dr. Corey Klein.
Thank you, Greg. I wanted to take a minute to thank St. Mary's Hospital and Community Hospital and the Veterans Hospital for their collaboration, and also Jeff Kerr at Mesa County Public Health. I do think we are in a significant point in our history, and as a community to collaborate in the way we are, I too am truly grateful for being able to be a part of this. We also are preparing for a surge of patients. We are working with our partner hospitals and the health department on how we would play our role. We have an adequate supply of PPE, and I do want to thank all of the community members who have made donations. Anyone who wants to make a donation can do so through Mesa County Public Health or through the Family Health West Foundation. They are also receiving supplies. Any donation given to our foundation is added to the communal supply of supplies in the county. So donating to any one hospital helps everyone. I wanted to spend a moment today as a physician to talk to you a little bit about the importance of still being seen by your doctor. A lot of people are very fearful of the coronavirus to the point where they may not be leaving their house or leaving their house minimally, and that's a good thing because we don't want to spread the virus amongst others. But we do need to remember that we're in this for the long haul, and that a lot of patients have lung disease and diabetes, heart disease, high blood pressure, and all of those things actually make you at higher risk for death if you do come into contact with the coronavirus. It is really important that you have optimized medical care during this time, and so I encourage all patients that have medical illnesses to continue to talk with your doctors. Have a telehealth visit. Have an in-person visit if that's absolutely necessary. Do the things that you need to do to keep yourselves healthy and to stay well. The last thing we want is more patients in our emergency room when that could have been prevented because of routine medical care. So please keep in touch with your doctor and keep taking care of yourselves and stay healthy. Thank you.
Thank you, Doctor, and thank you to everyone, to all the speakers today. As we wrap up, I just want to give a few thank you. First of all, thank you to Chelsea here from the Center for Independence, a wonderful addition to our efforts here. And also to all of the healthcare providers on behalf of the city, on behalf of the community, thank you. Thank you for what you've done, thank you for what you're doing, and thank you for what you will be doing. So we're all in this together, and it's just a reminder to community members, you can help manage this. You can be a part of the solution by staying at home when you need to stay at home, going on the essential travel, only the essential travel, and the doctor made some excellent suggestions there. So for the City of Grand Junction, I'm Greg Katyn, the City Manager. Thank you again for joining us today.